Enter the room.
Hi, I'm one of the doctors here at the GP. Please, can you confirm your name and your age?
I'm June and I'm 55.
Please, could you repeat that? I didn't hear you.
My name is June and I'm 55.
Okay, is it okay if I call you June?
Yeah, that's all right, doctor.
All right. So I see from my notes that you had the test done. Um, could you just tell me? I'm here to tell you about this test, June.
Yes,
Okay. S-
I'm the
All
results.
right. So I'm going to update you about the test results, but I just want to have an overview of what happened before now. Could you tell me why you came to the hospital in the first place?
Well, yes, doctor. I've been feeling lately, and yeah, I was a little worried that it could be related to some thyroid issue, especially since my sister has hypothyroidism. So I wanted to get all the tests done to make sure there was nothing wrong with me.
Oh, I see. I will see how we can help you best in this, okay? And how's your sister doing currently?
She's all right. Even she used to have tiredness before, she was diagnosed with hypothyroidism. So I'm thinking I could be having the same thing.
All right. It's a good thing that she's doing well. Are you having any symptoms at all?
Yes, I'm feeling extremely tired, and it's been going on for months now. I would say like about 5 to 6 months.
Oh, okay. And is there anything that makes this tiredness better?
Nothing. In fact, it just keeps getting worse. Even after I get up from sleep, I still feel so tired.
All right. I'll see how I can help you with that. Aside from this tiredness, have you noticed any other thing?
Like what, doctor?
Like, have you noticed that you feel cold when other people feel hot?
No, not really.
Okay. And have you noticed that maybe your any pains in your bones?
Mm,
Hello.
no pains.
Okay. All right. How is your mood like?
My mood is fine. Yeah, I'm all right. Yeah, but I just like the tiredness.
Oh, all right. And okay, I'll just ask some questions now, okay? All right. Are you experiencing any fever?
No, doctor, no fever.
Any swelling on any part of your body?
Not that I've noticed.
Okay. And how's your appetite?
My appetite is all right.
All
Kind
right,
of
that's good. And have
lately.
you noticed any weight changes?
No, doctor.
Okay. Are you sleeping very well?
I sleep all right, but even after that, I kind of still feel tired.
All right. And are you being managed for any medical condition?
Currently, no, not really.
Okay. Are you on any medications at all?
No, doctor.
All right. Do you have any allergies?
No, doctor. No allergies.
Okay. So aside from hypothyroidism, which you mentioned, do you have any other family history of any medical condition?
Yeah, like I mentioned, I've been kind of, very constipated lately, and even this is trying to go away.
Sorry, please, could you repeat that?
I've been feeling very constipated of late.
Oh, I see. And do you? I'm sorry that this is happening to you. I'll try to help you. Okay. And do
Mm.
you pass wind since you feel this constipation?
Do I pass what exactly?
Do you pass gas?
Oh, yes, yes. I feel very flatulent as well. Yeah.
All right. Okay. So, do you have any idea what might be causing this?
I have no idea. I thought you could fill me in with the results, but I think it's hypothyroidism. Yeah.
Okay. And sorry, what are you most worried about?
I'm actually thyroidism has it.
Okay, what do you expect from me today?
Well, I was thinking I could get some medications because her symptoms seem to go away with the medications for thyroid. So I was thinking if that's the case, I'd get some too.
All right. Okay, Jane. So at this point, I would like to tell you about your test
2 minutes
results. Could you
remaining.
please lean forward?
Yes.
So, all right. So from the test results and from everything that you've told me, the test results shows that majority of the vitamin D levels and calcium levels are quite low.
Um, what does that mean, doctor?
All right. And do you follow, June?
Not really. What does that mean?
This basically means that okay, so this means that the your calcium level is quite low. I'm just going to ask you a few questions, okay?
Okay, sure.
Hello. Oh,
Yes.
network.
Yes.
All right. Have you been having any falling?
Have I been having any what?
Sorry, have you had any fall?
No, doctor. I haven't had any fall.
All right. So I'm not exactly sure what this is, but due to the fact that these parameters are quite low, I would like to involve my seniors just to have them take a look at you.
All right.
Okay, and we'll also be starting you on some supplements. Are you okay with that?
Sure. Yeah.
All right. And I'll also give you this leaflet that says everything you need to know about this condition of low vitamin D and calcium. But if you notice that you have any falls or maybe you notice that this constipation worsens, please come back, okay?
Move on to the next station.
All right, doctor. Yes.
Thank you.
So, good job. Yes. This is a little bit of a misleading case because when you ask the patient what she thinks about her condition, she complains of it being related to hypothyroidism, and that's hypothyroidism, and that's probably why she got the test results done, isn't it? Right? So, initially, all right, but I'll just give you an idea about this case. So, what exactly happened? You will be provided with the candidate information that says that the results will be there in the cubicle, or else you might be given the results outside in the candidate information as well. So, as soon as you enter, you might just get a leaflet with, the test results, right? So, before you actually indulge into exploring the results, the first questions that you must ask is, why the test was taken, what were the symptoms leading for the test. So that way you get an idea of what the presenting symptom is. And that is very important because that is what you're supposed to correlate with your, the test results. So let's quickly look at the results. So she came in with tiredness. That was your presenting symptom. So whenever you have something with tiredness, what are the things that you're thinking of, right? Let's open that question up to our audience. So when you present with tiredness, what are the different conditions you should be having in your mind? Anybody? Um, Guys? Anyone has any opinions? Oh, you can comments as well. Yes, Dr. Farao, go ahead.
Well, one of the top differentials for tiredness, you'd start to think in a woman of her age, maybe anemia, something related to hormonal changes, um, as well as you could inquire about maybe depression. It can present
Yes,
as tiredness, the hypothyroidism.
absolutely. That's great. Amazing. So we got tiredness related to anemia, hormonal disbalance, and depression. That's three. And questions were perfectly asked for that. And even if you're not asking questions for that, you have the test results for that. So when you're actually thinking along the lines of tiredness, you're literally looking at the hemoglobin and the TSH because she's actually worried about hypothyroidism. And you can see that both of them are normal. So what are the other things that you should be thinking about? Any electrolyte disbalance, right? Electrolyte disbalance, usually like hyponatremia, they also come with like tiredness. Those are the first presentations of hyponatremia. When it's mild to moderate hyponatremia, you actually come with tiredness. So that's also something that should be going on in your mind. So you're thinking of any medications that could interfere with that, right? So moreover, but you actually get a clue. So even tiredness, again, one thing, if you are thinking along the lines of anemia, you have to think about the diet. What kind of a diet is this person having to rule out any vitamin B deficiency, right? And B12 deficiency. So you can actually see that vitamin B12 is also somewhat normal, right? So what is the issue that you're seeing? You can see that the issue is vitamin D and calcium, right? So when you now you get a better idea of what this could be. So you ruled out anemia, you ruled out electrolyte disbalance, you ruled out hormonal changes, you ruled out mood changes. So now you are coming literally by asking those questions, you can actually see that all of them seem to be normal, but the issue lies in vitamin D. So now close your question down to what could be causing this vitamin D deficiency, right? So now the and fatigue and tiredness is related to vitamin D, by the way, deficiency of vitamin D. So now think about all the conditions that could be causing vitamin D deficiency. So a little bit about the vitamin D, metabolism. How exactly do we get vitamin D into our system? So first of all, you need to get diet. Rule out CKD and malignancy. Absolutely. Dr. Paravel is saying malignancy and CKD. That's also a very good, differential to rule out, because those are a couple of, red flags that you have to, screen for. So Dr. Precious very nicely asked about any weight changes. Weight changes can also present in hyper or hypothyroidism, any kind of swellings in the body, lumps and bumps, appetite, right? Sleep also, that was a good one to actually rule out any problems with depression. Even sleep deficiency can also come present as tiredness, right? Now, when we're looking at these test results and we have ruled out all the other causes, now what are the important things to understand what could be causing vitamin D deficiency, right? Now, there are a couple of important points that you need to keep in mind. And in order to ask those questions, we need to understand how exactly is vitamin D entering our body. Definitely, there is, food related to vitamin D that you need to be taking, like oily fish, egg yolk, any fortified cereals or dairy, So understand the diet. Now, once vitamin D enters your body, it actually, it actually is in the form of cholesterol, 7-hydroxycholesterol, which is found in your skin. So now this is a very inactive form of vitamin D, and for it to be active, you need sunlight, actually UV rays, in order to convert it into its precursor form, which would be cholecalciferol. Right. So this cholecalciferol, after the conversion from 7-hydroxy cholesterol due to the UV rays, it gets converted to cholecalciferol, and then it goes to the liver to actually get hydroxylated. So it'll get 25 hydroxylated to become 25 hydroxy cholecalciferol, and this is the storage form of vitamin D, and that's exactly what gets tested. So if you see, it's vitamin 25 hydroxy vitamin D, that the stores of which is tested, and that itself is low. So now you have to think about why is the store low. So one could be the diet, number two could be any sun exposure, and number three, you're thinking along the lines of if there is any liver issues, why the hydroxylation is not happening. So think along those lines, ask those questions to quickly rule them out, right? And then the next place where it gets activated is the kidneys. So it gets 1-hydroxylated where it will become into its active form, right? So now this active form, what it actually does is it actually helps with calcium absorption. All right. So now only if there is vitamin D does calcium get absorbed. Now there is low vitamin D, and so the consequence of it is low calcium. Does that make sense? Right? So whenever you're thinking along the lines of vitamin D, always ask calcium. Or when you are thinking along the lines of calcium, always rule out vitamin D deficiency. These are two, investigations that should always go hand in hand. All right, I hope that is clear. So now, since you also know that there is a little bit of calcium deficiency, you can ask a little questions about calcium deficiency, like are you having any spasms, any muscle weakness, any twitches? Those are all presentations of calcium deficiency to understand the extent to which this calcium is deficient, right? So it could be a subclinical form or it could actually be a clinical form, because at this point, you have understood from your task that you have to be managing for the calcium vitamin D deficiency and as well as the calcium deficiency, right? You need to understand why the vitamin D is getting deficient so that you can actually give the right management so that the vitamin D stores is replenished. And also if there is any clinical presentations of any calcium deficiency, and also you will be giving calcium deficiency, so I mean supplements for calcium. So but then if once the vitamin D gets replenished, most of the times the calcium will also be getting replenished because that is required for its absorption from the gut. All right. So that's a little bit of an idea of how your questions should be. Let's quickly look at the scores. One moment, I'll just pull that up. All right, let's look at that. So, number one, Dr. Precious, whenever you're asking for identity, always ask the full name. That's very important to do because these are the identities that have been given to you. All right. So you can see by the question that the entire full name was given to you, but then I actually offered you just the first name. So ask the full name, confirm the name and the age. So make sure you ask the full name in identity. All right. And then ask about the presenting complaint. That was good. You actually started by asking, how long, why did you have this test done? What were the presenting symptoms? Because you need to understand what were the symptoms for which she got these tests done, so that you can actually make the connection. So that was good. Ask about the onset of the tiredness, like since when has this tiredness been happening. Ask about the diurnal variation. That's very important because if there are any autoimmune conditions, like say myasthenia or a couple of other autoimmune conditions that do present with tiredness, they actually improve with during the day. So there will be morning weakness, and then over the course of the day, it actually improves. Why? Because the circulation increases in the blood with activity, in the body with activity, and it kind of drains out all the antibodies that are created. So then the weakness also improves over time when they actually. So that is one thing, the aggravating relieving factors that would actually come into that, on how exactly, how does it improve or does it get worse during the day. Right. Otherwise, ask whether it's relieved by sleep. So then you can actually see that it's an ongoing tiredness. It's constant in nature. Even with sleep, it doesn't improve. And even if sleep is good, even if that is the case, it doesn't improve. Right? So impact of daily activity. This is very important. Like, why is what is actually, how much of this tiredness is affecting her life that she's come to get a blood test done. So understand a little bit about the impact. Like, how is this tiredness affecting your life? Because ultimately, you're not just treating the patient and the disease. You're not just treating the disease. You're treating the patient as a whole. You can make sure that with your treatment, they actually, their daily activities improve with the treatment plan that you have for them. Mood changes, that was good. Ask about constipation and frequency. That's very important. So there was another symptom that was given to you of constipation. So that should probably trigger a couple of things. And you see the age is 55 of this patient, and that's again a very important clue. Why? Because alternating bowel habits is one of the biggest risk factors for any colon cancer, and that actually warrants a colonoscopy screening. I mean, warrants a screening colonoscopy in the UK. So definitely you want to rule out if there is any alternating bowel habits, that could be interfering with, the absorption itself. Is she having colon cancer? Is she having something like celiac or IBD? Is it that the vitamin D is not getting absorbed, right? So, you need to understand the entire pathway where the vitamin D could be getting lost. All right. So another thing, ask about any bone pain, particularly. I think I'll give you a partial for this because you asked me about bones and falls, right? Do you have any pain, especially in the bony areas of your body, right? Especially the back, hip. Those are the things that you're supposed to concentrate a little bit more on. Muscle cramp, generalized weakness, assess for vitamin D deficiency. Also, this would actually account for your calcium deficiency as well, right? So you're understanding from the holistic picture, like how much of this deficiency is affecting her overall health. And then past medical history, is there any medical history that could be causing this, like any liver disease or any kidney disease, right? Ask about tingling, numbness, weakness to rule out any neurological causes. All right, now going on to the management, explain the tests. So whenever you're giving the explanation for the investigations, always explain all the investigations. This is very important because they have done a whole lot of tests and they want to know the results of everything. So even though the test results will be given back to them, so they need to understand what exactly is normal and what is abnormal. So you can just say it quickly, saying that for your tiredness, we tested you for any deficiency in red blood cells. We tested for some couple of vitamins and your thyroid levels, and all of them have come normal. However, then you start talking about what is the abnormal results. So whenever you're giving investigation counseling, whenever you're doing explaining an investigation, make sure to explain every single one. Try to club them together so that you can give it as a whole, right? Try to mention that all these tests that was done, it was normal, however, and then go on to the abnormal bit, right? So I think I'll give you a partial for this one because you only told me about reassure the patient. Okay. So yes, actually I'll give you a no because you never really reassured me, because I kept telling you that this could be because of hypothyroidism. So, understanding the results itself, that could be something that you could actually offer her, saying that, yes, as you presented with tiredness, we tested your blood for your thyroid levels, and they have all come normal. However, and then we can start with the abnormal results. Explain the vitamin D tests are low as well as the calcium is low. All right. Maybe you might know the cause for this, or maybe you might not know the cause for it. That's absolutely fine. But if you don't know the cause for it, you did exactly the right thing. Refer them. Refer your seniors to come and take a look. Get an expert opinion so that you could give the best possible care there is for this patient. Because at this point, if you feel kind of unsure of the diagnosis, definitely do ask for help. That is something that they are actually testing you for, rather than giving them any wrong diagnosis. Definitely they want to see whether or not, the examiners actually want to see whether or not you actually ask for help when in doubt, right? That's very important. Now so yeah, if at all you did manage to diagnose the fact that vitamin D was deficient, explain her how exactly vitamin D is stored in the body, and what its vital role is, because of which she's having calcium deficiency, right? Explain the role of vitamin D, which is, an important vitamin for your bone health as well as your calcium levels in the blood, right? So explain the role of vitamin D, which is needed for calcium absorption in the blood. So because if vitamin D is low, there is a very likelihood of your calcium also to be low. So we have to make sure to replenish the stores for vitamin D, right? And then talk to her about different ways in which she can replenish the stores. Right. So understand if she has any sun exposure. If she doesn't have any sun exposure, you can actually advise her on, getting some, 15 to 20 minutes of sun exposure so that, her vitamin D metabolism is proper. Right. And then there is the treatment of vitamin D. So since the vitamin D is low, usually in the first 6 weeks, you give a loading dose of this vitamin, right? After which you actually give them a maintenance dose. Either you know this or you don't know this, it's fine. You can just say that we will be giving you supplements that will replenish your stores for vitamin D. Right. So make sure you add what you would be wanting to give. So in this case, you would ask her to get adequate sun exposure. You would be giving the vitamin D, supplements. You will be advising her to take food rich in vitamin D, right? And also, you've seen that there is a aspect of calcium, deficiency. You will also want to give her a little bit of a calcium supplement as well, right? As well as food rich in calcium, right? Then you would inform the patient that if vitamin D levels do not improve with treatment, refer her to gastroenterology. Why? Because now she came with the other presentation of constipation. So you want to rule out any gut pathologies that could be interfering with vitamin D, right? So initially you will start by, giving them supplements and, supportive treatment for the vitamin D levels in the body. Or else, even if after those, management, it's still not improving, you would want to get a referral from a gastroenterologist for their opinion to see if there is any gut pathology that is causing this, right? So that is also something you can actually warn them, since you have had constipation for a while. We just want to clear and rule out any gut pathologies that could be interfering with your vitamin D levels, right? And then informational leaflets, good job on that. And then the follow-up. So since you've already given her so many different management for vitamin D, you want her to come back and get tested to see if those managements are working, right? In order to see that the vitamin D has been replenished, right? So you definitely have to set up a follow-up and blood test as well to see vitamin D levels there, right? And safety netting. So if what could be worse, how could it be worse? This tiredness, the presenting symptom itself, you mentioned that if your tiredness is getting worse, or if you're having, numbness, confusion, unsteadiness, or even severe constipation, please do let us know and, seek medical help immediately, right? All right, so interpersonal skills was warmly greet and introduce the patient. That was good. Acknowledge and validate her concerns about the possible hypothyroidism, right? So that is the main concern that this patient is having, right? Like, is it hypothyroidism? I think it's hypothyroidism because my sister has it, because that's the only presentation that she knows could lead to tiredness, right? So you definitely want to, clarify that doubt or that misconception that she might be having. So that's also your issue that you need to identify, that she thinks it could be hypothyroidism, but however, by your testing and your expert opinion, you are clarifying the fact that it is not hypothyroidism, right? So that is something that you need to always incorporate. Understand the patient's concern, ideas, and validate them if necessary, right? So since this is not something that you could validate, you could actually correct it, right? Signpost, ask you a few questions, that's good. Signpost before management, empathetic and sensitive language while explaining the diagnosis and treatment. All right, good. All right, I guess there's a lot of room for improvement. That's all right. This was your first try.